They say you're going to regret your decision to liposuction fat from your face and to remove buccal fat pads, because fat is golden, and as you age, depleting this fat will age you. And I think they're right. So why do I keep doing it? And why are my patients so happy? Hi, I'm Dr. Jonathan Zelkin, board-certified plastic surgeon, here to answer the age-old question of facial fat versus facial aging. The two seem to be in a constant war. They seem to be sort of inversely related, wherein having more facial fat keeps you looking younger, but it also prevents you from having that sort of sculpted look that is unquestionably sexy. So how do we sort of bridge this gap? Is it makeup alone? It doesn't seem to be enough for a lot of people. Is it surgery alone? Is it extreme forms of surgery? There's a really, really good solution, and that's a combination of buccal fat pad removal, liposuction of certain areas of the face, and radiofrequency-based skin tightening that have worked very well for me and the patients that I select to perform this procedure on. So why is having a chubby or a fat face pretty? Why? Why do we love the way little kids look and have this tendency to grab their cheeks? That cherubic appearance that we see oftentimes, for example, in the Buddha, is something that we, I think, universally want to take in. It's not a threatening look. It's not something that causes fear or angst in anybody. It's a very peaceful appearance to have soft features of your face. It's beautiful. But can you have that and have a defined jawline at the same time? The answer is probably yes, but it takes some degree of artistry and restraint on both the patient and her surgeon's behalf. So if we look at a Buddha, for example, you see the pouty lips, you see gentle contours in the lower face, you see overall lack of shadows. And this is all because of a facial fat covering that hides, for example, the nooks and valleys of the facial skeleton. I mean, if you had tissue paper over a facial skeleton, you would look downright frightful. In contrast, if you have a soft tissue covering, it looks really pretty. But then when you do your Zoom meetings or people are taking pictures of you at certain angles, you feel more like this. Because in excess, this soft tissue covering detracts from beauty, and you really want to find that fine line. So it is true that if you take away facial fat, you are going to push yourself towards a fate, if you will, of depletion and wanting to have something addressed. But that time will come decades possibly from now, and it's not something that needs to be addressed at the present time. To my knowledge, I can't think of any individual procedure that is as versatile, for example, as a facelift, that not only addresses the skin tightening, but also the fat. But that's not for everybody either. So I'm going to present today a case of a beautiful woman who is youthful, and she wants to maintain her youth, but she wants just a little bit more jawline definition, a little bit more sculpture. And for this patient, I was very liberal about my buccal fat pad resection, and I was also liberal about liposuctioning fat from the right areas. I will maintain that the buccal fat pad is independent of the soft tissue fatty envelope. And so anybody who doesn't like a fullness right here is a candidate for that procedure. In addition, when you take that out, you still may have perioral mounds, jowls, and lack of definition in the back due to fat accumulation underneath the jawline. These areas are prime targets for liposuction that shouldn't come back to haunt you as you age. So check this out. So much of this operation is optimizing the patient experience, and really I take a lot of care to make sure that the transition from being completely alert and feeling things to being numb enough to allow me to perform a procedure is a seamless one. The buccal fat pad removal starts off the operation in most cases because I think it's a point of anxiety for some people, and once they realize how not bad it is, the rest of the operation typically goes pretty swimmingly. So you've seen this operation a lot, and one thing I want to really emphasize in this video is that I am very aware that there is a inverse relationship between facial fat content and youthfulness, and that when I take out fat from the face, It is very, very deliberate, and I make sure that areas where fat excess never looks good are treated, whereas areas that volume looks good are, it's relatively neglected, and that includes the angles of the mandible in most cases, as well as certain aspects of the neck region. So I would be the first to tell you that I agree that taking out too much fat will give you an aged appearance, but I also feel that it can be done well. And if taking out too much fat gives you the sculpted appearance that you want, but yet you still have laxity afterwards, that means that not enough issues were addressed, not that the operation was a failure. And that's the most important take-home message that I can relay in this video. And the results do speak for themselves. I mean, this is a patient who had a pretty liberal amount of fat removed, and it didn't make her look older in any way. It certainly just enhanced her jawline, gave her more slender features, and kept her looking as commanding as she wished to look. I hope that this video can really shed some light on the way an artistic and controlled liposculpture of the face is something that will be resistant to time and does not cause a gaunt appearance the way global fat loss like weight loss or other conditions can cause. Also, removing the buccal fat pad really helps with dynamic actions and may not even show a significant change at rest. These procedures, when performed carefully and with restraint, will give you a result that allows you to bridge that gap between timeless beauty and a sexy, well-defined jawline. I hope it helps. If you like this video, please don't forget to subscribe, like this video, share it with your friends, and by all means, ask questions. I love when you guys ask questions because it gives me an opportunity to answer these questions in subsequent videos. Take care.